Welcome to Adopt a Pet Today, sponsored by the Pet Care Foundation. I'm the host for today's show, Heidi Hubner, and today we are at Kitten Rescue. This is an amazing group. Everything that they do is all for the cats and the kitties. You can find them at kittenrescue.org. And without further ado, let's talk to their executive director, Sandra Harrison. Hi, Sandra.
Hi, Heidi.
How are you?
Good to see you.
Love, we've known each other for a very long time. All right. Tell everybody, Kitten Rescue, what do you guys do? Who are you?
Well, we started off rescuing kittens. Our founder started Kitten Rescue to rescue the tiniest kittens from the shelters because they were euthanized at the end of the day. But now we rescue everything. We rescue kittens, seniors, a lot of medically alerted cats from the shelters. We rescue cats from the streets as well as the shelters. And this is our sanctuary where we house up to 150 cats and kittens. And it's like the hub of Kitten Rescue. And about 1,600 other cats live in foster care.
With your group.
Yep.
That's incredible. But they need more fosters.
Yes, that's right.
They're not up. They need more fosters and volunteers.
Yes, never enough.
Okay, thank you. So I know it's kitten season right now, and we're going to meet some bottle babies in a minute, but just talk about kitten season before we meet some of the older cats.
Well, we call it kitten season, but it seems to never end these days. It used to be, we get like October, November, December, January, February off, but and the kittens, then spring would come and kittens would be born. But because we have such a mild climate here and we don't have much rain, kitten season seems to be going on continuously these days. But kitten season is when kittens are coming in off the streets from community cats or people that haven't gotten their cats sterilized, and they end up in the shelters, and the shelters can't care for them, and so we have to step up and take these kittens from the shelters and from the streets to find them homes. And sometimes they need to be bottle fed.
Yes. So again, if you have pets at home, spay and neuter. It's the law, by the way, and there are many, many programs that can help if you need assistance. And if not, this is a great resource, Kitten Rescue, their website, kittenrescue.org. You can find answers to questions you might have. So I think we'll talk to Lindsay now and meet some of the cats that need homes. So, all right, so now we're going to speak to Lindsay, and she is going to introduce us to a lot of the cats that need some homes. So, hi, how are you, Lindsay?
Good, how are you?
Very good, thank you. So who do we have over here?
Over here we have, this is Rebecca. She is one of a bonded pair. She came with her sister, Amber. She's around 9 months old and obviously looking for a home.
Is that Amber?
That's Amber, that's her sister, yeah. Very different personalities. She is more shy of the two. Amber is more outgoing. But they are definitely bonded, so we would like them to go home together. This is Dorian. Dorian is, as you can see, he's missing his tail. I'm not sure the circumstances why he's missing his tail, but it means that he's incontinent. So it takes a very special adopter for Dorian that can handle that, having an incontinent cat in their house. He's very sweet, but he's a special needs cat basically. And another one there, and Rugsy has the same condition. Rugsy, female, she's very sweet too. Again, same issue, she's incontinent.
That all bottles.
Generally, they are. If they're missing a tail, it's like it can be a birth defect, which makes them incontinent, or it could be from an accident. Yeah.
I did not know that. Thank you for sharing that. That is interesting. And then, Lindsay, who is this beautiful one?
That's Izzy. Izzy is a senior as well. He has some medical conditions, so again, it would be an experienced adopter that can handle giving him medication on a daily basis. But yeah, he's a great kitty, but he just has a few medical problems.
Don't we all? All right. Who's this handsome baby up here?
Cabbage is he's kind of middle-aged, I think, and he is, we say, semi-feral. He is adoptable, but he is kind of a look, don't touch kind of cat. You can pet him. He will allow pets, but on his terms.
So let's talk about what a feral cat is really quickly for our listeners who may not be familiar with that term.
Feral cats are generally cats that have not been socialized. There's various degrees of it. You know, you could have them where they come completely, they've lived on the streets their whole lives. They don't want to be around humans at all. Generally, the ones we have here, they've adjusted to us, but that doesn't mean you can touch them and pet them. So, you know, we have a few like that in the sanctuary, and obviously they have a home here for life if they need it, if we don't find adopters for them. But some people will adopt a cat that they can't really touch. I have one in my house that I can't touch him, but he's happy. So
Listen, I think that's great. There's everybody for everybody out there.
Pablo, unfortunately, right now, Pablo is confined in his enclosure. He has a upper respiratory infection, so we don't want the other cats to catch it. He is also FIV positive, but that doesn't mean he can't live with other cats. He can. He also, when he came to us, he had his eye removed. He had a bad eye infection, so he had his one of his eyes removed. But he actually has a pending adopter right now. They're just waiting for him to get better, so that's really good. Good news.
That's great news for Pablo. I love that. And again, any of the cats and kittens you see today, kittenrescue.org is where you can find them. Who is that, Gilbert? Is that?
Yeah, Gilbert has a condition called cryptococcus, where he needs daily medication. And he's living in an enclosure right now because he's difficult to medicate. So it's easier for us to give him medications when he's in there. He does get to roam around, and he likes coming out, being with his friends. But again, he's adoptable. He just needs daily medication.
Okay, now we have some bottle babies here that Sandra is going to talk about.
Hi. They don't have names yet. We rescued this is one of two brothers we rescued from West Valley Shelter. They were, alerted to be euthanized at end of day. That's what happens with little bottle babies when they're in the shelter system, because they don't have the staff to care for them. So we take them here. We have lots of foster homes that take care of these little babies. And this one's a chunky boy. His brother is a little bit smaller. Let's see. We had a difficult time with him for a couple days. I thought we were going to lose him, but he's catching up to his brother now.
Well, they're so sweet.
Oh, they're so cute. This is the cutest age.
And Sandra, if somebody is curious about helping with the bottle babies, do you help teach them how to do it? And let's talk about that a little.
Yes, we have a network of foster parents that specialize in bottle babies. And so there's a great support network within our organization. And we will teach you on the spot how to bottle feed. We will get you a mentor you can ask questions to. And it's really rewarding. It's really, like, everyone thinks it's so hard. And I think in the beginning it is, because you think, I have to set my alarm. I have to wake up every 2 hours. But the truth is, I lay with them by my head in the bed, and if they start to cry, I wake up and I feed them. Like, you don't really have to set an alarm clock, and then all day, you can keep feeding them. But it's I don't know, they're so cute.
It's rewarding. I've done bottle babies before, and this is the only chance they have.
It's the only chance they have. And I know people, you can get them. It depends on the shape you get them in. Sometimes you get chunky little babies, and sometimes you get ones that have been like a long time without their mom, and it can be really challenging to bring those kittens back, but you've got to give them all a chance, right?
Absolutely.
2 kittens.
We should call them Bebop, B and Bop.
Okay.
Bebop. Oh, look at this baby. You want to help, don't you? See, animals.
You should see my pickle with the kittens. It's so cute.
Yeah.
List.
All right, Lindsay, let's talk about these.
Absolutely. Yeah, they are, as you can see, a bonded pair. That's Elroy and Bam Bam. They were actually part of a litter of 4. But yeah, and they've stayed really bonded with each other as they've gotten older. They're about 9 months old. Very sweet kiddies. So we'd like them to get adopted together, of course. 2 brothers. Yeah. Very special boys.
So basically, they have ages, colors, you name it. Whatever cat you're looking for, you're going to be able to find it at Kitten Rescue. Okay, let's talk about this one, Lindsay. Who is this?
Rolo. Rolo was found on the freeway. A Good Samaritan brought him to us. He was found on the freeway with a few injuries, but nothing major that he needed any surgery. So he is actually FIV positive. We're looking for a foster home for Rolo. He's a chatty boy. He's about 3 or 4 years old, and he's a great kitty. He has to be an only cat, though. because he gets a little bit feisty with the other cats, but he wants all of his humans' attention. Loves people, yeah.
Okay, and this is Salem up here. Salem is gorgeous.
Yeah. Salem is a gorgeous panther. He came to us from another rescue, and we
He's from West Valley. He had stomatitis really bad, so he was alerted to end of day. And we had to have all his teeth removed, and he still needs some steroids because it's a difficult case, another difficult medical case.
But I think, we're showcasing these cats that we'll call somewhat special needs. And this is, when you decide to bring in any, dog, cat, bunny, whatever into your home, whatever animal, they need to go to the vet, just like us, to the doctor. You need to make sure they're getting their, annual wellness physicals, just to hopefully try to prevent these things that happen to them. All right, Lindsay, tell us who this gorgeous fella is in here.
Okay, this is Milo. Milo is kind of a tricky case for us, as he's special needs in respect of he has a special diet, and because he has allergies. He's very vocal. He's been adopted a couple of times and returned. The first time he was returned, I think, for his allergies. So he's on a good diet now, and we've got the allergies under control. The second time he was adopted, I believe he escaped from his home. So he's a tricky cat to adopt out, but he's great. He's a really nice cat. So he's looking for a very special adopter or a foster. But he needs to be the only cat in the home.
Yeah.
Yeah.
And this is what's great, Kitten Rescue, they know all of these cats. And so, they're going to be able to help find the perfect placement for you. And, donations, they're always seeking donations, whether it's monetary or if there are special needs, if it's special food, being able to donate the food to them. All right, let's talk about this beautiful orange tabby, Lindsay. Who is this?
This is Laszlo. Laszlo is an enclosure because he gets overstimulated and can fight the other cats if he gets overstimulated. But he's a great kitty. He, again, needs to be a solo cat, but he's really nice. He's young. He's only about 2 years old, very playful, and would make somebody a great companion.
Thank you. And then I know we're going to go to this. I think her name is Edelweiss. She is stunning. And those blue eyes. I don't know if Dusty's able to get those, but oh my gosh.
Edelweiss, or Edie, as we call her, she's been through a lot. She had really bad allergies, and we managed to get her allergies under control, but she does require some allergy shots, monthly allergy shots from the dermatologist, and a special diet. But she's a really great cat.
It's interesting. This is just my side note. I feel like animals are having more allergies, just like people, because things in the environment are changing. I never had allergies, and I'm having them now. And I don't know. I could be wrong, but I'm going to say I'm right. Okay. Oh my gosh. Who is this? Who is this baby?
Linguini, talking of allergies, it's the same situation. He has to be by himself because he has allergies as well. We're still trying to figure out what he's allergic to. But again, it's a skin issue, and they need to see the dermatologist. He gets allergy shots or steroids to control it. But yeah, he's doing much better.
He's got beautiful eyes too. And it's, a lot of having a cat that has to be on allergy shots or medications is no big deal.
They're eligible for foster as well, these cats. So to get them in a foster home where they can get a special diet, it's very, difficult. They can't come out with the other cats here because of the food. So we would love to place these, if not in a permanent home, in foster care would be great too.
Good. Can we stop?